You are listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians from across the nation, answering your questions about your pet. Bark and Wag's podcast is produced every Monday for your enjoyment, and show notes are found at www.barkandwag.com under the podcast tab.
Today, we're talking to Dr. Susan McMillan, owner of Pet Mobile Veterinary Service in Burlington, Vermont. Welcome, Susan.
Hi, Polly. I'm so happy to be with you on your first broadcast.
Well, we're excited to have you. And what a great topic to talk about. What do you do once you get a pet? What's the next step? And so with talking to you today, we're going to find out some tips about how to find a vet. So Susan, please take it away.
So you just got a new pet, or maybe you moved into town, and the first thing you want to go is go to the pet store and do all kinds of fun things. But you should remember that one of the top things you should do is find a vet and get established. You don't want to wait until it's an emergency or you're in need. It's really something that should be at the top of your list.
And when you're looking for a vet, do most people, do you think, word of mouth?
Yeah, I think a lot of people use word of mouth. If you have a dog, you know, that's something that's sometimes so much more social between dog parks and dog walking and dog classes. People get to talk a lot. You know, who's your vet? What boarding facility do you use? Do you go to doggy daycare? I definitely think talking to your friends and asking their opinion is a great place to start. And then there's a lot of questions you want to ask. And I can go into that with you. I think a really important thing is you want to find a vet who has a kind of the similar attitude that you have.
Okay.
Some people want to do every vaccination that's out there. They want to protect their animal from everything, and that's a great way to go about it. Other people want to be a little more careful and thoughtful and choose their vaccines. But what you want to do is find a vet that you can talk to and who you feel listens to you. And you want to ask a lot of questions when you're on the phone with a vet clinic before you make your first appointment.
And so is it pretty typical? I know having children that a lot of my friends went and interviewed a pediatrician before they actually took their child to that doctor.
Really?
Is that pretty common with the veterinarian services?
I don't think it's as common as you might think. I mean, I don't have kids, so I didn't know that parents did that, but it makes sense because hopefully you're establishing a long-term relationship where you want to really be able to trust either this person or this clinic with this pet or pets that are really important to you. So I don't think most people do. I mean, I do sometimes have appointments that when the front office staff makes the appointment, they call it a meet and greet.
Okay.
And maybe that actually is the owner interviewing me. All I know is it's the first time I've met this person. But I think it's a great idea to do a meet and greet, especially if you're someone who wants to have a close relationship with your vet, where you know them and you trust them. You don't want to just go every year and get your shots. You really want to have a relationship. Then I think you should do a meet and greet.
Okay.
I think you should go with a list of questions.
And what type of questions would someone with a new pet or even moving to a new town, what type of questions do you think are the most important for pet owners?
I guess it depends a little on your pet. Just to get it out of the way quickly, obviously, if you have exotics, if you have a snake or a bird, or you have a pocket pet like a hamster or a ferret, then you want to make sure maybe all your pets can't go to the same vet, but you want to make sure your vet will see those pets. But if we just kind of hone it down to more of the dogs and cats realm, then, so let's say you have an old pet, and maybe your pet has some chronic issues. You want to go to a vet who is willing to have the time to talk to you about the issues, maybe what diagnostics are needed, what treatment options there are. You want to have a vet who is willing to entertain your questions, whether you have a puppy or an old cat or you just want someone to have the same kind of attitude about your pet's care that you have.
And is there a certain type of, education or just if they have a pet, or like when you walk into the veterinarian clinic, obviously make sure it's clean, that the staff is nice, and okay, kind of the basics.
Yeah, the basics, but all of those things are totally important because they all mean something. Is the vet clinic clean? I mean, if it's not clean or it doesn't smell good, what does that mean? And if you have to wait a long time, or if the people at the front desk are really busy and don't seem to have the time for you, then, if you don't feel comfortable, maybe you want to go somewhere else. If you have pet insurance,
yes,
you want to make sure that your clinic is comfortable working with pet insurance. If you are into alternative medicine, maybe you're into acupuncture, or at least you're open to the idea of herbal things, or herbal remedies, or chiropractic care. Then you want to make sure your vet is maybe also either available to do that or is happy to help you find the right referral.
Okay.
Again, it's you feeling comfortable with this. And another important thing is some of these bigger clinics, and this is not a prejudice, but some of the bigger clinics have many, many veterinarians on staff. And if it's important for you that you always want to see Dr. Smith, or at least Dr. Smith and Dr. Jones, then, you should ask that.
Okay.
Can I request to see a vet, and will I be able to see that person, or do I just see whoever's, available that day?
And what about what do you feel is the normal? I mean, I guess it all depends, but a normal wait time.
Like to get an appointment?
Yeah.
Well, that's a tough one. I guess you would want to be able to get in, I would say if it's not an urgent thing at all, I would say within 2 weeks feels reasonable to me, especially since if I call a dermatologist, my appointment is 6 months out. I mean, if I call a human dermatologist,
right,
I can't get an appointment for 6 months. I think 2 weeks, but I guess that's another thing that's important is how comfortable do you feel with the wait time? And most clinics these days, well, I think I can say most clinics don't do their own emergencies, especially if you're in a bigger city. So you have to feel comfortable with the emergency arrangements that they have. Do you have to be seen by your own doctor, or ideally you're okay being seen by the local emergency clinic?
Well, most of the time, I know where I live, the emergency clinic is 30 or 40 minutes away.
Oh, really? Even in Chicago?
Yes. Yeah, there's one in Grays Lake and there's one in Buffalo Grove.
Wow. I totally would have assumed that in a big metropolitan place that you would have had one closer.
Yeah.
So we're in Burlington, and our emergency clinic is probably 20 minutes from me.
Okay.
But I don't have any choice. There is not. If I'm a regular pet owner, I don't think there's a vet clinic in town that still sees their own emergencies maybe past 10 o'clock at night.
Sure. Right. Yep.
Another thing is, for cat owners, there are cat-only clinics out there.
Okay.
And those are really a fantastic option, especially for cats that are more timid. You won't have to sit in the waiting room with a dog staring down your cat. And the cat, the people that work at cat clinics are obviously very devoted to cats, and they're really good at special handling techniques, and other clinics are good at it too. But for some people who have only cats, sometimes a cat-only clinic is a great option.
Okay. And so when you're moving into a new town or looking for a new vet, is there a central place on the internet that the pet owner can go to find a new vet or
there's always a state veterinary association.
Okay.
So you'll at least find a listing on the Illinois Veterinary Medical Association site or the Vermont Veterinary Medical Association site. There's often a local veterinary association. Definitely the internet is the place we go. Like our clinic, we personally don't advertise in the yellow pages anymore because no one was using it and it's really expensive. So you want to go online, but you also, you really want to be careful looking at certain sites. You want to take all of the ratings, you want to take them all together, and you also want to talk to people because probably there's not a business in town that hasn't annoyed someone.
Sure.
That person might be the most vocal person in town. So you don't ever want to take one bad rating or one bad comment because, first of all, it may not be the whole story. Mm-hmm. And it may be one in a million.
Well, and so that's what it's important when we first talked about going to visit the vet before, you make up a commitment, because obviously a pet is with you for the next, 9 to 15 years.
20 years, right.
Yeah, especially if
you really
have
want
a pug.
You really want to have a good relationship. Can I backtrack on one thing?
Sure.
Another option that a lot of people, interestingly, don't even know is available is it's a mobile vet. And we have a mobile practice, and we often see people and they just say, "Oh my God, I had no idea that that you were available." So a mobile vet is someone who either comes to your house and examines your pets and treats them in your house, or some people actually have a big van, almost like an RV.
Sure.
And it's like a mobile clinic, and they come to your house and your pet leaves your house and goes into this little van. But in either case, for some people who have either multiple pets that don't travel well, maybe sometimes the owners don't travel well. There's a lot of different reasons that people really like seeing a mobile vet. And there are mobile vets all over the place. So almost no matter where you live, if that sounds like a good option, then you should look for a mobile vet.
Okay. And is it you all everything? I mean, so everything from vaccinations to general health?
Yeah, as a mobile vet, so you have to think of your full service vet clinic and everything that includes. These days, that includes x-rays, blood machine, a surgery suite, a dental suite, and a whole lot more. So our mobile clinic doesn't have any of that. So we do a lot of basic medicine. We do a lot of preventative care. We do a lot of end-of-life care.
Okay.
So in the human world, that would be more like hospice care and palliative care. And then we do a lot of vaccinations and routine kind of consults. But we wouldn't be doing the surgery and the dentist
sure. Okay.
and all that you need.
Okay.
And we work with other clinics, and kind of in tandem, we get all of that done.
Dr. Susan McMillan, thank you so much for being on Bark and Wag's 15-minute podcast. We certainly appreciate your time, and we look forward to talking to you in the future.
Polly, it was my pleasure.
So once again, you're listening to Bark and Wag's 15-minute Vet Talk. Each week, we will interview vets from across the nation answering your questions about your pet. If this is your first time joining us, thank you for listening. Bark and Wag's podcast is produced every Monday for your enjoyment, and show notes are found at barkandwag.com under the podcast tab.
Thank you for listening to Bark and Wag's 15-minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.